You're always gently assessing with the pads of your fingers. Okay, so everybody go like this. All right, what happens when you have a sore muscle? What does that look like? Everyone go like this. You have a sore neck. What does it look like? Oh, I have a sore neck, right? So that's what we call a circular massage or circular friction. You don't have to remember any names. But what you're doing, as I like to call it the technical term, you're feeling around. Okay? So here's the cool thing about your assessment massage. It means you're gathering information about your dog, but at the same time, you're actually massaging your dog with the tactile part of it. And anytime you put pressure on your dog, whether you're holding, you're stroking, or I'm feeling around like this, or pressing in, you're affecting the nervous system. And we actually, to get specific, you're pressing on what we call large diameter fibers of the nervous system. And those fibers, when pressed down, actually block pain. So when we're doing this assessment, we're actually increasing blood flow, we're getting junk out of the tissue, we're affecting these nerve fibers, we're blocking any pain that may be there, we're increasing lymphatic function, circulation, but we're gathering information. So this is done every 3 or 4 weeks. Why not every week? Because you want to be able to actually discern changes, okay? So you're looking for things that are abnormal in your dog, okay? You are going to start with some gentle strokes on the muzzle. When I pull back like this, and feel free to do that, I can feel from the nose back if there's any bumps on the gums. If your dogs let you go in their mouth, you can actually go in and feel if there's bumps on the gums. Also part of your assessment is to lift up the flue and to actually look and smell, okay? Because there might not be swelling, but what might there be? There might be some decay, some bleeding, okay, some pus in the gums. But because dogs have different structures around the mouth, you may not notice it by just being on the outside. And you may smell, if they're ill or something, they'll have an odor in their mouth. Any bacteria or old blood will also smell. So we want to use our own snout and our eyes too. And her teeth look beautiful, her gums look beautiful. I don't feel any heat. I'm going to go around the eyes. You don't want to poke in the eyes, but I'm going to feel around the eyes. Then I'm going to go to the ears, and you're going to place your hand on top of the ear and in general feel for heat, okay? And then I'm going to lift up the ear flap or the pinna, and I'm going to actually smell and look in the ear, okay? If you smell yeast, like a yeasty, if you see congestion in there, you want to rule out an ear infection or maybe just overly congested ears, wax, dirt, whatever the case may be. Once I've done that, I'm going to go to the base of the ear and I'm going to move the base. So I could do the flaps and I could look in, no, it looks fine, but then you start manipulating the base like that. And here's what you're looking for. The dog is going to turn and look at you. The dog is going to pull away. The dog's eyes are going to get big, okay? The dog may get up and leave. These are subtle signs because you know what, guys? Your dogs are not going to bite you, but they could if they're in that much pain or that much discomfort. So it's these subtle signs that they're not feeling. Now I'm going to come back down to the neck and just under the ear, guys, this is important. You're going to feel for any unusual large lumps behind the base of the ear and then underneath the jaw. So again, you're using your circular massage friction to just feel around, and you guys can go like this on your own body, and you should actually be able to feel your lymph nodes. How many of you have gotten a bad sore throat or cold and all of a sudden these puppies get really big? This is really important because we want to feel for big lymph nodes in our dogs. They may look fine, but if they're sick, those nodes can enlarge. That's the body's way of trying to fight disease. Okay? Now,
where are the lymph nodes on there?
So there is, we call it the submandibular, which if you find the line of the jaw on the dog and yourself, Yep, your right, go a little bit behind there. Okay. Good. That's a submandibular. Also right behind the ears, guys. Okay. And right here is the retropharyngeal. But notice that these are two primary ones that if there's something going on here, okay, those puppies are going to get pretty enlarged. So now I'm going to go down to the chest. The axillary area here in the chest is another area where if there's something going on, you will feel big lymph nodes. But what's really nice about this, and this is when you're doing the assessment, sometimes it gets them to lay down because this holds them up, these muscles. So you start gently feeling around in there and they're like, oh, that feels good, I'm going to lay down. Okay? Particularly if they like to sit and they don't like to lay down. So I'm feeling for anything unusual. I'm feeling, here's the point of the shoulder. If a dog has like a bicep tendonitis or shoulder issues, this could be really tender because you can actually assess around the bones. Okay? A joint is where two bones come together, like the shoulder, the elbow, the wrist, the digits or fingers. It's important to know if you go over that joint and you feel heat, that something could be going on in the joint. The typical diagnosis in our dogs is what? Arthritis, right? Or they have joint disease like dysplasia of the elbow, dysplasia of the hips, torn ligaments, sprained joints, that type of thing. So what you'll feel is you'll feel heat radiating off of it, and that's why your touch is really gentle, because if you go in there and you start doing this right away to your dog, I don't feel anything. It's like, you know, feel your leg really hard right there. That's, yeah, I mean, I feel, well, there's not much muscle there, but, you know, you're feeling. But if I go lighter, I can feel the definition of the different muscle fibers. I can feel the knee, I can feel the bones around the joint. So for our dogs, what you're looking for when you go around the joints are thickening at the joints, okay? If the dogs have issues with joints, the body will lay down scar tissue, you'll feel thickening because it's the body's way of stabilizing that, right? That's normal, but you gotta know if it's normal for your dog. So now I'm gonna go down to Kayla's wrists, okay? And I'm going to just mobilize the toes a little bit. We're not going to get into range of motion today because we have too much to do, but you can just gently move the toes and the wrist and see how your dog accepts that. The main thing that I want you guys to do, because you don't do this when you pet them every day, right, is you're feeling in between the digits for cysts, maybe a foreign body, okay, maybe a loose nail, maybe a split nail. These are things that normally, even when we go, I give my dog a 5-minute massage up here, right? Okay? But we're not intuitively looking for things, and that's what the assessment massage is about. But you know what? It still feels really good, right? Because I have to massage it to assess it. Okay? Then I'm going to come back. I'm going to go underneath in the armpits. There's a line of lymph nodes from here all the way down the back, so you want to feel for that too. But now I want to feel what's going on in each side of the spine. So if you guys gently take your hand flat-handed and gently, you're not pressing down on the spine. So I'm going to go on each side. This is particularly important if your dog had back surgery. Because what happens if something's going on in your dog's spine, the muscles on both sides of the spine, there are a ton of muscles that attach on the vertebrae. These muscles are going to bunch up like this, and they're going to feel like little bunched up balls on each side because the muscles of the back are kind of funky. You have muscles that kind of go like this, they start here, attach here, kind of they're overlapping. So you're like, why is this kind of bunched up on one side, but not down here and not over here? Well, it's that segment of those muscle groups that are in spasm or really tight. So if you feel like you're doing this circular, and I'm just feeling around on each side, and you feel it lumpy and bumpy or hot or swollen, then you know something's going on with that, okay? There should always be a little give in the gut, okay, so in the abdominal area. If it's extended or distended, and it's really hard, then that's a little concerning, okay? They got some GI upset or something's going on in general, or there's an injury there. So what I like to do, and you guys are gonna love this, and the dogs really relax to this, is you're gonna take both hands and you're gonna hold, and I, just from the simple assessment, Kayla's belly is fine, okay? I see that, I don't know if you guys can see that little bit of, I do just a little bit of pressing in and it should bounce back, okay? If it feels hard, we want to discern, is this something going on in the belly? Or did they just did they run a lot, or are they just tight? Maybe they have back pain, which is constricting their abdominal muscles. That would make them really rigid and tight, would make me think, wow, maybe something's going on in their back. So what I do is I just kind of hold, and this is one of the techniques we're going to show you guys in a minute, is you're just holding. And as it softens, I can add a little bit more pressure and go in, and now I'm getting more sponginess, okay? That told me that the abdominal muscles were tight for a reason, and not that the visceral organs, something was going on with them, okay? You will find if you guys, your dog has GI upset, maybe they have the runs or constipation or something, that this is a perfect time to get in there and do these gentle holds on their abdomen, okay? By all means, assessment-wise, if the stomach is descended and rock hard, then you see that immediately. So once I've gotten the belly done, I can come back to the hips, same thing. I'm going to just feel on top. This is an area of, a lot of dogs have issues at the lumbar sacral joint. You're going to go to the side of the hip and you're going to feel a little bump there. That's called the point of the hip. That's actually where the hip joint is, okay? If you go inside there, that's where the hip, so you're not touching the hip joint, you're touching kind of the outside of the hip joint. But this is where you're going to feel a lot of heat or maybe some swelling if there's a hip joint problem. Then I'm going to do the same as I did in the front. I'm going to feel for spasm, or what we call ischemic muscles. Now this is a technical term for crazy tight muscles. Same thing with the paws. On the back is the front. I'm going to move them around. I'm going to test for any foreign bodies, thickening. So I'm feeling a lot of scar tissue. Yeah. So these are things Zach knew from 3 weeks ago. Okay? You're going to feel skin tags, scar tissue, things like that. Again. And then the last but not least, the funnest part of all, you're going to check out the bottom area, okay? For those of you guys that don't have a weak nose, you can smell your dog's bottom area as part of the assessment. Yes, those dog people smell their dog's butts. It happens. And only, you don't have to get your nose that close. If the dog has an anal gland problem or blood in the stool, you will be able to smell that from about here. You can lift up the tail. I always like to lift up the tail, okay? If there's a sprain in the tail or a low back spinal issue, they're not going to want you to move that tail, okay? So these are things that you can assess in the back end. So before your massage, watch your dog move. Have them do the normal activity in your home. If it's normal for them to climb the stairs or get up out of the bed or the couch, have them do that. Can they still do that? Usually what's going to happen if something goes on is what, guys? You're going to notice they're not doing their normal stuff. So, that's it. That's your assessment massage.